Old age is second childhood, but very few have given this adage a fair contemplation due to the fact that experience is the best teacher. People age differently, and they are aging brain facts. As we grow old and older, there are conditions that come with the package, like it or not. Your later life is determined by your present environment or experiences coupled with biological circumstances which may never be evaded.
The brain has a tendency of shrinking. As it gets smaller in size, it loses some of its function. There will be physical changes that happen. We have mental changes that happen.
In this episode, we look at dementia, a condition that many fail to understand.
Inonetsa nekuti sevanhu vakakura tine machembere taizoona zvichiitika kuti vanhu vakuru vati kurei avo vanokanganwa, vanodzinguva vanenge vane hasha dzakanyanyisa, kana kuti unogona kuona achitaura ega. Sometimes unongoti pamwe muchembere vaita se vakura, kana kuti vazhinji sekumamisha nekungwatengofamba ukatosvika unonzwa kuti mukavatemera vagara vega, kana kuti vari pamvuri vanenge vachitaura vega vachiita sevakutaura nemunhu. Vanhu vakutofunga kuti dzonguva munhu uyu ane zvaaita mukurarama kana kubata-bata kwaaita, saka zvinhu zvaakumupindukira zvekuti vanhu vazofunga kuti chirwere chinotobata munhu. Vazhinji vanenge vakutosema munhu kana kutosana munhu, zvekuti sometimes unotongona muchembere kuti vana havachatomuone, vanhu havangosiwa vachigara yega, vazukuru kana vanga uine vana vanga vachigara nagogo vakutotorwa.
Zvinonzi dementia ingava first time kunzwa that name, but ndinonzwisisa kuti nyaya yechirwere chekukanganwa. Chirwere chekukanganwa ndinoona chine vanhu vakati wandei, especially kumarural. Ndine vanhu vandosangana navo vakati wandei, vanenge vachiratidza kuti vamwe vacho vanoita sekuti vatorasika njere. Zvimwe zvacho handizivi kuti zvinonyanya kukonzerwa nei, zvokuti vari vapana vechidiki pamwe pacho tomboti pamwe madrugs avanenge vachinyanya kutora zvinoita kuti brain dzavo dziite sekudzoka kumashure. Vanhu vanofamba vachitaura vega. Indaifunga kuti vanhu ava vanofunga zviri loud, havafungiri mukati. Zvinhu zvekuti totombonetseka kuti zvinhu izvi zviri kunyatsokonzerwa nei.
I think ndongori neka-idea kuti it's something that is related to issues of mental health. Someone also akamboita, I think it was just a small experience whereby I was college, and then ndakangoita that condition, ndakango lock up brain and I couldn't recall my passwords, all the passwords dzakabva dzatongorasika musystem, including e-learning, including my bank cards. Saka pandakangoziva after ndaenda ku-IT ndikangopiwa my password, the other things they were unlocked now. Ndo pananda kuziva, saka it's just a rough idea.
Dementia is a syndrome describing various symptoms of cognitive impairment of brain functions such as memory loss and judgment.
Dementia is a disorder, or rather a mental condition that mainly affects people who are elderly, mostly people who are over the age of 60 years or 65 years in some places. It's mostly characterized by changes to the way that people think, as well as the way they interact with other people. So therefore it will then have characteristics of having someone having forgetfulness. It affects their memory. It also affects their thinking process. Therefore the reasoning also sometimes changes. You're not able to reason out with them. But there are also other changes that happen even physically to people who do have dementia, such that they struggle even with social interactions, and they also have problems even with doing activities of daily living, like even buttoning their own shirts, putting on shoes, or even cooking for themselves.
Zimbabwe has diverse beliefs which will always contradict and will never be in sync. Of course, different people believe in different things. The causes of dementia will then differ depending on which platform you are speaking from.
Zvirevo izvozvo zviri pasi pevhu apa zvematateguru edu nedzinza redu takasikwa takadaro kuti tinofana kushandisa mitombo yechivanhu inodzikamisa nekubvisa mhepo dzinenge dzichipinda mukati menyama, ndo temberi yevadzimu vedu. Saka kana ndakagara kudai ndiye ndichinzi ndiri temberi yematateguru edzinza rangu, zvichireva kuti ini kana ndichinzi ndiri mhofu handifanirwi kunge ndichiteera dzinza revaira mwoyo. Kana ndichinzi ndiri mhofu handifaniri kuteera dzinza rematateguru Jesu. Kana tiri kuchivanhu chedu tinoti chechi iseneme yevarungu, hatina rudzi navo. Saka kana iwo wanzi unofana kurarama pachivanhu, iwo akunoita zvipikiswa nekunopikinura mhiko dzakatarwa nematateguru ako, wanopika naJesu, asi kana wasvika pamba unochinzi titambire sinyoro. Kazhinji mweya wetsvina unodudzira kuti mafambiro ako iwe mukati medzinza rako pane zvausiri kuzadzikisa, pane zvamusiri kuita, pane zvamusiri kugadzirisa maringe nechivanhu chenyu, maringe nekuteera midzimu yenyu nenzira dzayo, mabatiro azvaitwa nematateguru yenyu vachararama. Imi mopikisana nazvo moti isu hatichaiti izvozvo, takuita zvokunamata. Hanganwa dziri kunobva pakuti vadzimu vedu vanenge vakutiranga neshamu maringe nemafambiro atinenge tichiita tabuda mugwara redzinza rematateguru edu, takuteera gwara rematateguru asiri edu, ndo yechinamato ayo. Saka izvozvo zviri kuzonotiburitsira shamu yekuti unozobatwa yakunzi BP mushure mekunge watanga kukanganwa kuti watsveta maki yemota apo, next maki yemota hauchazivi kuti watsveta pai. Wasiya mwana kumunda uku, next hauchazivi kuti mwana ndamusiya papi. Hanganwa idzozona kuti uri kuvunzwa kuti wakupenge, wakupenga ndoshona chainotaurwa, asi wakupenga wakukanganwa kunyanya kudai zvamboita sei. Dzahanganwa dziri nomo here kune vanhu vedzinza vanokuziva uri nomo sezvazviri, vanotanga kuzvikanuka. Vakatanga kuzvikanuka vakutoti ngatimbofambai.
One of the fundamentals of Christian spirituality and Christian faith is that as human beings we are created by God and in God's image. However, the same God who created us in his image is the same God who created us with physical bodies. In other words, human beings are physical beings. They've got physical bodies, and their physical bodies are vulnerable to infections by diseases that can be caused by either viruses or bacteria. For example, we know from the biblical stories that we've got the priest Eli, who when he was old, the Bible tells us that he could not see properly. Why? Because he was a human being with a physical body. There was no demon in Eli's condition, but the fact that he was a human being, he was vulnerable. Even David, a man at God's heart, we are told that when he was old, at 70 years old, he had challenged that he could not warm up, but there was no demon in David's condition. Why that condition? Because he was a physical human being with a physical body. So the God who created us in his image is the same God who created us with physical bodies that are vulnerable to any infection. So we cannot say that every dementia condition is as a result of demonic attacks or spiritual attacks. No. Of course, there might be cases, but not every case is as a result of demonic attack. When we say that not every case is as a result of demonic attacks, in other words, we are leaving room for a possibility for that angle whereby we say there are some cases whereby dementia can be as a result of demonic attacks. Why? Because we know from the beginning, from the early stories of the creation of the human beings, that the devil is spoken of as to be very cunning, such that he can do anything unexpectedly. We know that from the stories of the Old Testament and the New Testament, the devil could attack human beings in such a way that in some cases he could cripple them. For example, if we read the story written by Luke in Luke chapter 13, we know that Jesus at some point was teaching in a synagogue, and Luke says that as he was teaching, there was a woman who was crippled, and he was not crippled by the natural infections. She was not crippled by the natural infections. She was not crippled by
whatever other means. But Luke is very clear that she was crippled by evil spirits. And Jesus knew that. That's why he had to deliver that woman from the oppression and bondage of the evil spirits that had caused her to be crippled.
Fatigue can also cause forgetfulness and may not point to dementia. Studies show that the onset of dementia may be found in young ages as early as the 30s. The causes of dementia are complex. Among the causes is HIV-related dementia, which occurs when the HIV virus goes to the brain.
There are multiple causes that have been found in research. So to start with, we have different types of dementia, and these are differentiated because of the different possible causes. So we have examples of the ones that are commonly known, things like your Alzheimer's dementia. There's also what is called the Lewy body dementia. There's also vascular dementia. Vascular dementia is mostly found in people who have had high blood pressure, who are hypertensive. Mostly if it is not well controlled. There are also other types like Parkinson's dementia and other several types of dementia. Even people with HIV can also get dementia. So there are various causes, and they tend to have been found to be acting together, meaning that there are many factors that actually contribute to one having dementia. What we know mostly about the causes is we know that they are risk factors, not necessarily causal things. There are also commonly things like changes that happen to one's brain. Changes like where you have continued deposition of particular proteins in the brain. These proteins are okay if they're in a limited amount in the brain, but when they start being too much in the brain, they affect your brain and the brain neurons such that eventually they affect the areas to do with memory, the areas to do with reasoning in the brain, and therefore one ends up having dementia. And other environmental causes can also be attributed, and also other medical conditions like your high blood pressure, particularly in vascular dementia, and also HIV. HIV can also affect one's brain and one's neurons, therefore leading to dementia, particularly after a long period of time, and especially if it is not managed well.
Let us go through the stages of the condition up to the point where it becomes very severe.
We have the early stage of dementia. This is usually a period of between 1 to 2 years of onset of the condition. In this period, usually you may not even notice, because dementia, like I said, is associated with aging. So you may not even notice that the individual has dementia, because they will be having maybe problems with, they will be forgetting. They may be having problems with remembering names, but to a lesser extent. So you may actually think maybe it's just because they're growing old. Then we have the middle stage. In this middle stage now, the dementia will be now affecting some other mental functions. Like you tend to find the individual has mood swings. The individual may start exhibiting violent behaviors. They may even tend to have eating disorders, eating problems. Then we have the later stage. Now the later stage is now from 5 years or more of the condition, of onset of the condition, and here now the individual will be exhibiting more physical problems, like they don't want to walk, they don't want to do anything for themselves. They're actually at a period of total dependence. They want other people to help. They need somebody to help them, even to remember their own name.
Many diseases are of a hereditary nature. Diseases like cancers, diabetes, asthma. How about dementia from a spiritual perspective?
If we see it becoming hereditary, such that almost every member born in a family becoming demented, obviously that would be a sign that the evil spirits are at work in that family?
It can be in terms of genetics. If you have had, particularly for people who have Alzheimer's disease, if you have a family member who have had, maybe your mother, your father, or your grandmother has had Alzheimer's in the past, there are specific genes that are actually associated with having Alzheimer's. But it doesn't mean that if you have that particular gene, you are definitely going to get Alzheimer's.
And a point to take note of, dementia is a syndrome and not a specific disease. Thereby, it is regarded as a condition due to its different kinds of symptoms.
A disease is where you can specifically find a particular cause, but because dementia has different kinds of symptoms in different groups, because we call it medically, it's a neurocognitive disorder, meaning your brain is affected and there are lots of different little facets of your cognitive function, which is the way that you think and the way that you reason things. So it's different little groups of symptoms put together. Therefore, that's what makes it a syndrome. So therefore, one can be affected mainly in the way that they reason out things. So that is, their executive function is impaired, and their memory, yes, is impaired, but not to a greater extent.
The World Health Organization says 50 million people are diagnosed with dementia worldwide. There are nearly 10 million new cases every year, indicating that there is one case in every 3 seconds. However, this may not be the actual figure, as many developing countries are not capacitated to diagnose dementia, and in some cases, patients are not taken to hospitals for diagnosis due to complacency that it's just old age catching up with an individual.
With Zimbabwe now, the statistics are not so clear, but based on reports since the latest about 2018, there is about 3 plus or minus 3 million of people who are diagnosed with dementia, of which I think there is a limitation to the statistics because it's easy to get the numbers if people are coming forth for assistance.
You get so comfortable saying, this is my grandmother, she's old, so we expect her to be forgetting things. And even if she's they'll say she's moody this day, she doesn't want to speak to people. And people will not seek attention for that. But even in terms of the medical research itself, there hasn't been much research done on dementia itself, and let alone going as far down as to be able to differentiate the different types of dementia that are there.
The World Health Organization warned of a projection of 82 million cases in 2030 and 152 million in 2050. The most common type of dementia, Alzheimer's disease, is said to affect 5 million Americans, with predictions that by 2050, 14 million people will be having the disease. It is the 6th leading cause of death in the United States.
What we've taken note of is the difference in development in our countries. We find that in the United States, it's a well-developed country. They can diagnose the different types of dementia. Like you said, your question was Alzheimer's. Here in Zimbabwe, we can only do clinical tests, which is just like more of an umbrella term to just pick up and do like symptomatic diagnosis. But then that's how they have the equipment to readily do tests which will then dictate in which type of dementia one has. So this side we're limited to knowing the particular type of dementia. So that's why we may be biased to say that side there are more people with Alzheimer's as compared to this side. Maybe we have a greater number than them, but just because we haven't yet got there to diagnose it like fully.
It might seem like other countries or rather European countries, first world countries do have the condition more than us, but that's not particularly true because of the studies that have been done in other continents. There hasn't been shown to be any difference whether you are well up or you are not in terms of who gets dementia and who doesn't get it.
Treatment is crucial for any disease to heal or stabilize a patient's condition, and for caregivers to be able to manage them well. Traditional healers will tell you they can actually heal any disease.
Murigwe iwoyo ndo mushonga unorapanura nekugeza mvura iyo inongoiswa mukombe yogara musango. Munhu uye anopota achiuya akamwira mudare osumuka onogezwa kunze kwesango, apedza izvozvo akunomwa mvura yake musango imo. Mazuva ake akangopuwa mazuva ake manomwe ndo 7 days. Anofanira kunge atoo munhu kwai zvoupenyu hwake hwese.
Men of the cloth will concur with what the Bible says in Luke chapter 1 verse 37, for with God nothing shall be impossible.
We know that our God is omnipotent. He is not limited. He can do whatever he wills to do. Even those cases that human beings cannot do, God can do. We know that he can heal. Why? Because the Bible says, with God, nothing is impossible. We know that even situations and conditions that are incurable with human beings, they are curable by God.
From the medical theater, experts say there is no cure for dementia. After medication is given to stabilize patients so that they do not feel overwhelmed by their condition, it will also be a huge burden lifted from the caregiver's shoulders.
It is not really particularly one cause. What we know more of is risk factors that people have. But when you look at, we advocate for early recognition of the condition. But for conditions such as vascular dementia, the one that's associated with changes to your blood vessels, mostly because of high blood pressure, if you're able to recognize the high blood pressure or manage it appropriately, therefore you're going to prevent dementia from happening. If you have HIV and the HIV you're on antiretroviral therapy and it is well controlled, that prevents the dementia from happening. But for other dementias such as your Alzheimer's dementia, there tends to be a deterioration as the years go by. And for us, there is no medication that is actually there to cure or to stop the dementia. But there are medications that have been found to help with at least slowing the process of that deterioration in function. So you find most of the management is not just medical management. So me being a medical practitioner and having associations such as the Dementia Association, there is that multiple disciplinary association. So you have either the medical doctor, a psychiatrist managing the patient. Sometimes we add on an occupational therapist who assists with activities of daily living, how best the person can function even in their deteriorated state. And then you also have the support that comes from having support groups and also the caregiver. So it's about management, then comes more of a holistic management from different facets and different professionals, but not mainly medication.
Isusu vashandi vedu vari pano, manesi ari pano, tinoedza nepese patinogona kuti tivagamuchire sezvavari, tivape mukana kana vachida kutaura, kana vachida zvichida dzimwe nguva vanotoda kutochema chaizvo, tinovapa mukana wacho vozowana counseling kuti vagone kugamuchira.
The risk of having dementia rises as people age, and medical practitioners advise that people visit their doctor early if they start showing symptoms relating to dementia.